Hi, how are you both doing?
Great.
Hi. Good. It's gray and rainy in Ohio.
Yeah, same over here on the East Coast. I'm just so happy to have touched base with you all because I know that you're planning this amazing training in your area, one of your areas of expertise. So I'm going to ask you each to introduce yourselves. Um, Susie, would you like to begin?
Sure. Yeah, thanks, Diana. My name is Susie. I use she, her pronouns. I am located here in Columbus, Ohio, and have been doing EMDR for, I think I was trained in 2008-ish, and been using EMDR since. I started my career working with kids and have since now been working with adults as well. So I see, adults and children. Um, and work a lot with Tammy. We always joke that we really like each other because we work together a lot. But I do clinical work. I own a small private practice, have some training organizations, and also teach a lot of EMDR.
Yeah, so I'm Tammy. I use she, her pronouns as well. I'm here in Columbus, Ohio, and I can't believe I'm going to say this. I've been doing EMDR for 20 years next year. I know I don't look
Awesome.
that old. I started young, okay? Which is really wild to think about for me. And I always really liked teens and working with adults. And I've always just personally, in my personal life, love anyone who knows me knows babies and children and little ones. And I call them little muffins. Like, and so it was kind of, you know, suckered into seeing children because the agency where Susie and I met knew I liked kids, and our kid person was going on maternity leave. And here I am. Yeah.
Wonderful. So you are going to be co-teaching a training with EMDR in children, and I would love for you to talk about why we need this training. I can tell you that from the many people who I see as consultees, there are always questions, and there are modifications, and there are just different considerations. So please just tell us how your training is going to help people get to that place where they're feeling more confident in their work with kiddos.
Well, I think it's two-part. The training is some strategies how to work with children, but also some strategies that you can use when you have adults who have had developmental trauma or pre-verbal trauma in their lifetime. So in their younger years, or maybe even in their pre-conception years, even, which when you take the training, this won't seem so out there. But also, it's a training that you can use with people who have a dissociative profile, who have any sort of system or parts work. And so I think that's kind of a thing. People are like, oh, I don't need a training. I don't work with kids. I don't need this training for kids. And it's like, oh, but you do. When we start to get into some of this work that before language development and language acquisition, we know that our body remembers. We know that we have connection in our brain. It was just at a period where we didn't have language, so we don't have the words. And this training really helps set up pretty beautifully and quite fascinating way how to help people, no matter their age. Yes, right, who are children. I always say if we can get them when they're children, then imagine what great adults they're going to be. So it will kind of give all the tools, most of the tools, some of the tools, I don't know, Susie, which word, that you need to work with this difficult stuff that standard protocol EMDR just can't always get to.
Yeah, we get that question a lot because we, as consultants and trainers, we're pretty loyal to standard protocol, and we use it. I would say Tammy and I modify standard protocol pretty much with most of our clients. And then we get the questions about, what are some of these, first of all, how are we accessing these pre-verbal memories? And then also, when we're looking at some of these advanced protocols, what are some of the ones that we actually use? And, accessing preverbal memory and clearing emotional circuits is something that we've really incorporated into our practices, and then really seeing over time how we've kind of adapted and modified to using some of these strategies with kids and teens has been really fun. I would say, if we enjoy teaching about how to work with kids, but then kind of tying all of this together with working with, these early memories that oftentimes how we see it showing up with adults is you've worked on so much stuff, but there's still something kind of unexplained happening or some symptom that just hasn't resolved. And so then we'll kind of look at, well, what are we missing?
Yeah, and I think some of those things you'll hear people say, I don't want to do that thing. I don't want to have that reaction or that behavior, but I do. And a lot of that is what we know about learning and what we know about the brain is that children are automatic learners. They automatically learn. And when we think about what happens, again, without a young person even knowing, can very much carry over into adulthood. The simplest example, I'll say, anyone who is a caregiver or parental figure or has a young one in their life that they mentor, do you ever find yourself doing something that your parents or caregivers did that you really don't want to do?
No.
No, not me and Susie. Not Taina either. I'm telling you, we're like gold star here. But that can be as an explanation that I think people can really relate to. I also think knowing like Touchstone has a very, very broad basis or a strong kind of basis for all things perinatal. And a lot of these things can exist in that perinatal time period with, losses during that time, or also during conception and that time period between that and birth, some birth trauma, all of that, or some things that happen early on that we think, oh, the baby or the child won't remember. They remember, they just don't have language for it. And these things really kind of bring, I think, what we all want, which is the repair of developmental trauma and, index traumas. I think this, like Susie said, is that missing link.
So, Tammy, I know that recently you did some work with just kind of like a unique and a specific case where a child who had preverbal trauma, you were treating, and I'm wondering if you can tell us like a little bit about that. It might even be one of the examples that you're using for your course.
It may be. Yeah, what an interesting opportunity to kind of have the privilege and the honor to work with a family whose child had some preverbal trauma related to medical care and medical system and being in and out of the medical system with a medical illness, and who also, because of that, didn't have verbal language. Definitely had language, like we can mistake the two, but had some difficulties using verbal language and some other kinds of trauma responses that some might look at as like, oh my gosh, this is just how it's going to be. And so really, I would say anyone who works with children, you have to be creative. Susie might be one of the most creative people I've ever met. I tell her this all the time. You have to be really creative and really kind of easily able to pivot or easily able to deviate from any plan that you might have. So some of that work is with this child who really did not have a lot of verbal language. And so the first kind of part of that was figuring out how to best communicate, how to best, create this environment of you can be exactly who you are and show up how you are. And also let me figure out creatively what's the best way to talk about what we're going to do, and to really talk about experiences in hospital systems that didn't that obviously were impacting this child, but again, there's not language for. And it involved some really good a really good play therapy room, a lot of caffeine on my part, and then working with this child's parents to kind of understand what is already working, what's already in place, what do we want the goals to be, and what tools can we create. So having lots of photographs of things that actually happen. So you'll hear Susie and I in the training talk about right, pre, during, and post, like what were things like before this medical issue came up, and before all the hospitalizations and things like that. So really getting a good narrative from both of his parents about what that was like, and creating a sense of connection with parents and connection with important people in his life. And then taking this idea of affective circuits, right? Learning safety, for example, how we should have learned it, and for whatever reason couldn't, babies attached to their caregivers, and they want to feel loved and cared for. And a child who's in a hospital setting, and that is where they need to stay, don't get to have that connection. So starting with that primary kind of attachment, again, had really amazing, like, if I could take these parents and have them be all the parents of the kids we work with. People do the best they can, but this was a really unique case. And so working on some of that attachment, some like touch, and then moving through some of those circuits, and getting to looking at some pictures of when things were not so great medically. You think about the medical system and how jarring and how little respect we have for a person, like literally just for a person's kind of things we take for granted, right? We interrupt sleep patterns, we turn on lights, we don't have the food that we need or like, we don't have our clothes, we don't, and think about that in a child's kind of brain. So really working through some of that with a narrative. There's a approach Susie and I will teach called storytelling. And so, right, this is what it was like before, having a caregiver or adult who this has been rehearsed with, who can tolerate that traumatic material. This is kind of what happened, and then this is how it's ended. And one of the beautiful things in this case, I'm going to get the words wrong, but it kind of ended with, and you knew what your body needed, and you knew, right, how to get what you needed. And kids are amazing that way, in telling us what they need if we're willing to pay attention. Why am I getting tearful? Because it was so amazing. And just the transition from, this work of seeing less kind of acting out and more teaching this sweet little baby calm body. This child now does calm body in school, which I don't know that he would have made it to school before this time. And so it's pretty neat to see. I know it seems like, are you really doing much? And even sometimes Susie and I are like, are we really doing anything? And we get really amazing stories like this.
Yeah.
I love that. And I know some follow-up about that particular case, and that kiddo, his new vocabulary as he's practicing, his new thing is saying, "Oh my God."
Love it.
Oh, I need a video. I need a recording of that, please.
For sure.
Well, I think, Tammy, even your reaction that you're having speaks to the importance of the attachment too, which, having that attachment with our clients when we're working with clients who have had, disruptions and their, typical, or what their bodies and brains needed, is something that we'll emphasize as well, because this is something that, you will be connected to your clients, and you will see and kind of feel these changes because of that, repair that's happening kind of before our eyes.
Yeah. And I think thinking back some things, hearing like these parents say about this child, like he slept, and when he was woken up, it's just these tiny things of thinking about how a hospital system disrupts children's sleep, and thinking about from a child's brain development, not only am I disrupted in my sleep, but then something happens to my body.
Mm-hmm. Yeah.
And so really trying to creatively, like, let's maybe try this, right? Maybe let's be purposeful in how we wake up this child. And then you know me, and tap it in when it goes well. Yeah.
Yeah. I think that this case speaks to some of, sometimes you can see things obviously on paper, right? Like when you go through an assessment, regardless of the age, whether it's adult, a child, a teen, there's things that stick out to us as clinicians, things like, specific types of trauma or, impacts on attachment. But what we've learned, right, with this art of EMDR is like looking for those things, right, that haven't been paid a lot of attention to, but had a significant impact on development. People are having really disrupted relationship patterns as adults and different things. I've just really liked how that's kind of grown with how we approach our clients.
Mm-hmm. And really honoring a person's own story, right? Really honoring and realizing, Suzi and myself and our friend and family and colleague Lisa did some training on anti-oppression and using EMDR, in an anti-oppression lens. And I think this starts to see a whole person. And this really, for me, I'm going to speak for Suzi too, can pull away some of this pathologizing we do for children or we do for adults who've had developmental trauma. And I think one of the cases we'll share is of an adult who had some very early on developmental trauma and some patterns, right, of disruption that is kind of remarkable to look at in the end when you've repaired some pre-verbal work.
I love all of this. And now I'm going to ask a bit about the audience. So there are some people who are coming from different modalities. And they're saying, hey, now I've been trained in EMDR, but I really want to have a great arsenal for my clients in how to work with pre-verbal trauma, to work with kiddos, to work with adults who have experienced this. Who do you see as really your target audience?
I think there's going to be those people that sign up because they're like, yes, I keep seeing pre-verbal trauma. Kind of, what do I do about it? I'll admit, when I first started hearing about like going way far back, way back to, preconception, conception, all of these different things, I was skeptical. I was judgmental until I saw kind of some of this work happening. So I think we want to take wherever you are kind of in your readiness to kind of go further back to look at how can we use EMDR. But Tammy and I are both pretty eclectic, practitioners in terms of working through an EMDR lens, but pulling lots of modalities in. We'll talk a lot about, trauma responses and how we're managing those responses and resetting responses that we've learned. So we welcome everyone. We welcome wherever you are in your, again, readiness to kind of take this back to, explore potentially some of these early impacts on development and attachment. And yeah, I don't know. It's kind of speaking for you, Tammy, but I'm always open to wherever people are.
Yeah, I think that we purposefully have used children and adult as some of our content, some of the videos you will see, to kind of see the lens, right? To zoom out a little bit about this isn't just how to work with this particular thing. I just set up this affective circuitry resetting today with an older male veteran. And it made a lot of sense, right? It made a lot of sense. And I think that whether we're looking at developmental trauma because of abuse and neglect, or developmental trauma because of medical trauma, or parental medical trauma, and that sort of thing. I have another patient that I'm setting up some of this work who had a sibling who had a chronic illness, and so was by herself a lot. And that kind of dysregulation of not having a caregiver present. If you think of all the adverse childhood experiences and then zoom out from the age range of when those happen, or because they've happened, how someone shows up in their adult life. Though if those are your clients, which I know feels like a wide range, you should come. You'll learn something and you'll get to practice. You'll have practicum with each other, which Suzi and I had when we were learning this. And it, because we're EMDR practitioners, we're used to some of these practicums, and these practicums are actually really helpful to your own kind of, you'll see subtle shifts in yourself, but also you'll get to see where this process can take an adult client, which is really kind of cool.
So I actually had the opportunity to, Tammy, and just to kind of see you in action. It's interesting because we have this like personal relationship, then we have this professional relationship, and then I was able to watch you do some processing and drop right in with a consultee to say, and what did you learn? And what you just went into this series of questions. And I, in that moment, was just like, oh, wow. That's a lot.
Yeah, because if you look at even taking this, how we learn, right, psychotherapy and the process of psychotherapy, and, thinking I have this many years and I've done this, and so you have everything to learn from me, and this is how you're going to learn it. Maybe, but also like together, right, where we can do this work, and then some simple questions like, what did you see? What did you notice? What did you observe? Clinicians are natural observers. We have natural clinical intuition. And, do you have questions about why I did that instead of doing something else? And this protocols are really, it's not a difficult protocol. There's some repetitive nature to it that I think people are like, okay. And I sometimes will be like, annoyingly, I'm going to say the same thing again, but it's also, right, ask. And give me some insight too. Suzi and I are still learning all the time. And I think that's kind of the beauty of when you jokingly, if anyone knows our friend and colleague and family, Lisa, Suzi, and I, people were like, are you guys like a trio? We only know you as a bundle. And it's truly, we learn from each other still. We show each other grace, and our education knowledge shouldn't be only given to some. Right? It's this kind of thing that I want everyone possible. Suzi wants everyone possible to start to heal some of these developmental traumas, because the state of the world needs it. I just got real big, but the state of the world needs it.
Yeah, if there is one way that I could describe like what I have seen you do, and Suzi, I have this amazing window into like the way that you teach as well, is I would describe it as integrative. Right? It's integrative. It's not I teach at you. It's this is what we're learning together. This is where we're going for our clients, which I think is like just a beautiful process.
Well, and we've had really amazing mentors who've done that with us, who also have witnessed us at various stages in our life, various stages in our profession, various stages in our own self-confidence as therapists. And we've had that. And I think that it's really pushed us to honestly be a little less rigid about things and a little more open to how people show up. It really, I will tell you, when you take this, it will test some of the things you think you know about boundaries. It will test some of the things you think you know about structuring a session. But I'm supposed to be encouraging you to come, but I'm telling you, it will. You're like, ooh. And as we start to know more about how to really, I know I've said this a lot now, like show up for people, it's kind of disarmoring and, kind of flattening those hierarchies of teacher and student. So there's a really real practicum, and we also really want people to get what they need when they come and work with us and learn from us.
Yeah, because the flip side of that is we've had not great, experiences with teachers and, trainers and supervisors, et cetera. And so, we do really work hard to make this something that works for, for every individual, and we take feedback. Please give us feedback. We're always open to hearing the feedback and correcting ourselves when we're wrong and learning, new things along the way. we both really like to teach and want people to learn too. Like we want to be able to have lots of people to refer to and, to be able to do this stuff. And, it's also, I think, for some people that are maybe earlier in their EMDR therapy journey in particular, there is this kind of pull, I think sometimes too, like a part of us really wants to do it right and, not do any harm and follow the scripts. And so there's this kind of, resistance sometimes to going with your intuition or kind of going with your gut. And, again, that art of EMDR therapy. So we're hoping that this will help. We'll give some specific tools. We'll back that up with, where this comes from. But we also want to help people like just kind of start going with your gut on, you hear something talked about, or you hear kind of even intergenerational patterns that you can kind of start pulling out and looking at and finding ways to address. So I appreciate that feedback, Taina. That means a lot to me because it is something both of us work really hard to be approachable and
accessible.
Yes.
Right?
Yeah.
The different kinds of needs. I think that as we know more about trauma too, we my child just hi, thank you, I love you. People, we're live.
We're human. Yeah, we're human.
It happens. And who would not want to say hi to that cute little face? Oh, sorry. Oh, I think like when you look at intergenerational trauma, I feel like that's starting to become a thing that, is out there. I just personally got some new books on it this year, and repairing, doing some of our own work to make us even more able to show up for other people. I want to take our training now.
I am definitely taking your training, and I don't work with children, right?
It's for adults too.
We learned it originally only as an adult model. Only as an adult model, and have kind of made it because Suzi's the most creative human I know. Suzi.
My mom was a kindergarten and preschool teacher, so I owe a lot of that to her.
Fine. Carol Rutti is the most creative person I know, and Suzi Rutti is a protege. But it's like, wait, why wouldn't we catch this in this stage instead of waiting until someone's an adult and kind of having to adapt to these trauma symptoms and the impact of trauma as an adult? And if Suzi says do it, I do it. So
well, and it's very true what you said, that learning to pivot and learning to be, I mean, that it's a hard thing to do when you have a plan, you have a way, right? Or an approach that you're planning to do, especially standard protocol. It's like you have these specific questions you're supposed to answer. And then it's like, well, what if they don't have the answer? What if there's no image, right? What if they don't have the memory, but they have a body sensation, right? We'll talk about all of that because like Tammy said, we don't have the language. If we didn't have the language when it happened, you're not going to be able to do phase 3 in a traditional way. So we'll talk about how can we access that? How can we activate, right? Like Tammy was talking about some of those medical memories, that those things that, have been talked about maybe, but haven't, there's that question of how are we getting that now activated? If that happened a year ago or 10 years ago, how do we get in there and repair that? It's good stuff.
Love that. As someone who works a lot with intergenerational trauma, I just love this lens that is what I would say is an enhancement, an addition to the standard protocol, which is to say, hey, here are some other things that we can consider when people have had. So I happen to live in a place where we have one of the highest in the country rates of grandparents raising their grandchildren. And we also have, and this is something that is happening just kind of across the country, but a lot of opioid related situations that are impacting children. So I just love that this is something that can be accessible for the kids who are experiencing this now, or for adults who experienced that early on.
Yeah.
And we're not talking, so, again, Suzi and I both have received some pre-verbal, some affective circuit resetting, which you'll learn what that means, and have received some pre-verbal trauma work ourselves. And we're not talking necessarily about the worst trauma cases that you can imagine. Sometimes it's these slices, right? These things, these few pebbles that have really impacted a person and have kind of stayed with them in their bodies and their, way of being, that is really fascinating to me. That there's like a fascinating part of that to me that if you've taken any of our trainings, you'll hear us say, isn't it all trauma anyway? I'll put an asterisk, maybe one or two things are not, but it's kind of really interesting when I've done this work. We have lots of case examples we can share, but an example I come up with is, a very high functioning adult woman who could not figure out why she would get these moments where it felt like she couldn't breathe. Like we tried medication for panic. I mean, we tried all of these things, and it was like, wait, what would our mentor say to us? And she's like, you got to go back to pre-verbal, right? When the standard protocol isn't working, right? Let's reset some circuits and let's do some pre-verbal work. Come to find out, she grew up in an area where when she was a baby, got pneumonia and had to stay in a hospital by herself, with no caregiver, no adult, no nothing. And that's what came out. And she called a family member after our session, was like, did this happen? It did. Like, we didn't have the memories, but she could just see herself as a baby, get this sensation, these kind of cold, dark. It was just the coolest thing. And then I was like, we need to call and ask someone if this happened. But also, you'll see a video of a child when we were doing some of this work, that unknowing to him or to me, he draws out his entire birth story, which was a traumatic labor and delivery. And then I call his caregiver, and at the end, I'd be like, she's like, that's actually what happened.
Which we know sounds bizarre, right? We know,
I know
hearing this
right.
sounds bizarre, but it's in there, right? Those memories are there somewhere. And whether or not you have, the story, which is great when you have someone that you can call and you can check in and find, did this thing happen? But there's also just a way to release that, right? And to resolve that. So yeah, it's pretty cool stuff.
We know it sounds out there. We know it. We were you.
Mm-hmm. I am on the bus. I think that for anybody who's watching this, they are seeking, they are looking for, they know that maybe something can be added to their therapy toolbox. So I am so excited for this training. I am so grateful that you're going to be doing this with Touchstone. And I'm just looking forward to making sure that people have access to this content.
And if people are unsure, they can certainly reach out to us. Like, is this for me? This is what I do? Or sometimes Suzi and I would get training or would read or learn because we had a client that were like, we're not throwing in the towel just yet. We joke that certain cases, like each of us are an expert in certain thing because we became anything we could get about this. And this is kind of one of those things.
Yeah, they should not contact me, because if they said, is this training for me? I'd say yes. End of discussion.
Just contact Taina.
But we really are happy we love talking about this work. That's why, this is training Tammy and I have been talking about for years. So we're honored that Touchstone is hosting us and got us in gear to actually put it together and be ready to present.
Put into actualization, right? Yeah. Taina, Mara Tesler sign. They won't go away, people. They won't go away.
We're persistent little bulldogs, but no, we're
you, and we like you.
Thank you. No, I appreciate you both. Thank you so much for your time.
Yeah.
And we're looking forward to having this this Tuesday tea, but also the following training to be able to provide for the community. And we're just so grateful that this is going to impact so many clients.
It's early May, right?
Mhm. Yeah, we're
Yes.
excited. Hopefully we'll see a lot of you there that are watching, and reach out to us if you're not sure.
Wonderful. Thank you both so much.
Thanks,
Thanks.
Taina.